Nobuhisa Hagiwara. I hope it was the right pronunciation.
Thank you.
If you go to the stage, yes.
That's right. Yeah. Thank you very much, Person, and good morning, everyone. It's an honor to present our HIJ-PROPER result in this press seminar. This is my disclosures. The HIJ-PROPER was designed to determine whether the standard statin dose plus ezetimibe targeting LDL cholesterol of less than 70 mg would reduce cardiovascular events more than statin monotherapy targeting LDL cholesterol of 90 to 100 mg in patients with ACS and dyslipidemia. We enrolled 1,734 patients with ACS and dyslipidemia. The half are randomized to pitavastatin monotherapy. The other half are pitavastatin plus ezetimibe combination intensive therapy. The mean follow-up was 3.9 years, and follow-up rate was more than 99%. The primary endpoint of this study was composite of all-cause deaths, non-fatal myocardial infarction, non-fatal stroke, unstable angina, and revascularization with PCI or CABG. The LDL cholesterol was 135 milligram to 84.6 milligram for pitavastatin monotherapy and 65.1 milligram for pitavastatin plus ezetimibe. The difference at 1 year, the difference in LDL cholesterol was significant, minus 19.7 milligram, which equals to 0.5 millimole. This is a Kaplan-Meier curve for the primary endpoint. The event rate was 36.9% in pitavastatin monotherapy and 32.8% in combination therapy. The hazard ratio was 0.89. However, the difference did not show the statistically significant. This is the Kaplan-Meier curve for the primary endpoint based on intestinal cholesterol absorption marker, site-sterol. The site-sterol, the median value of 2.2 microgram. The combination therapy significantly reduced the primary endpoint by 29%. Our results suggest that the concentration of site-sterol might alter the effect of statin and the statin plus ezetimibe combination therapy. This result is potentially interesting since ezetimibe inhibits the intestinal cholesterol absorption. In conclusion, intensive LDL cholesterol lowering with statin plus ezetimibe did not significantly reduce cardiovascular events more than statin alone in patients with ACS and dyslipidemia. However, statin plus ezetimibe did reduce cardiovascular events more than statin alone in patients with higher baseline level of site-sterol cholesterol absorption marker. This intestinal cholesterol absorption marker may offer a potential therapeutic target for the treatment of dyslipidemia in ACS with dyslipidemia. Thank you very much for your attention.
Thank you. The floor is open for questions. Yes, please. The mic.
Lynn Peterson with Trends in Medicine. So is this sitosterol a common measure that is done in a lipid panel that we would be able to commonly use?
Yes. I think the pre-treatment measurement of the site-sterol is, I think, very important to determine which patient might respond to ezetimibe or not, or something like a dose up or statin. So,
Dr. Per, could I
is it-
refer that to you?
Yeah, the question is testosterone measurement practically used in everyday clinical work?
yes, we can measure the serum concentration.
You can, but do you do it actually also?
No, not yet.
Is it available
Is it-
in Europe or in the US?
No,
Is
not
this a-
not in our country. But it's an exciting thought. I don't know if any of the other speakers. No, I don't think it is an opening, but it's not commonly used.
Then it would
It's
just
not
ask the-
normally used as a clinical measurement in the United States,
Does
but
the
you can
panel-
order it special if you need to.
Okay. Does the panel think that this will change for statin plus Zetia use in Europe or the US? Will people start measuring this and reserving that for those patients?
Well, that will be a question of budgeting. Is it worthwhile? Shall we put our money there? I have no answer on that, unfortunately. Any further questions? Yes?
Michael Reardon with TCTMD. I just have two quick questions, one for the speaker and then one maybe for the panel. Is this a power issue with the study in terms of the number of patients that you saw a trend, but you didn't actually see a statistical difference? And the second for the panel, possibly about maybe if you could comment on sort of, or anybody, if you comment on the difference between the sort of the US and the European guidelines where there's a treatment to a target rather than, an intensity statin issue.
I see. Because the improved trial, the cardiovascular mortality was not different between combination therapy and high dose of statin. So maybe a non-fatal cardiovascular event was decreased by much more lowering cholesterol lowering therapy. However, I think the non-fatal cardiovascular event was decreased by much more lowering of the cholesterol.
But then again, looking at the numbers of patients, if there had been a clear, significant clinical relevance, I think the material would have been sufficiently large to detect that.
But if one looks at the absolute difference in LDL cholesterol of 19 milligrams per deciliter, or roughly half a millimole, the hazard ratio of 8. Oh, sorry.
Bit closer to
The hazard ratio of 0.89 was precisely what one would expect from that magnitude of absolute LDL reduction. So in some sense, these data are consistent with IMPROVE-IT. And if one were to analyze these data in a meta-analysis with IMPROVE-IT, adjusted per millimole per liter lower LDL, they would have nearly identical point estimates of effect, which speaks to your point of whether or not it was a power issue.
Last question.
Melissa Walton, SurelyTheHeart.org. Are there specific characteristics in patients that had an elevated sitosterol level? I mean, it's beta-sitosterol is an anabolic steroid. So is it more maleness? Was there a gender difference, et cetera?
Yes. I don't know the exact mechanism of the cytosol as a absorption of the cholesterol marker. We don't know, so we need a much more further investigation. I see. There are some absorption marker like cytosol and campestol or cholesterol is one of the absorption markers. But we measure why we measure the cytosol is because ezetimibe is the inhibition of the absorption of the cholesterol. So we measure pre-treatment measurement of the cytosol.
Okay, we go. Thank you.